pure tone test is performed on a patient to estimate his or her hearing threshold intensities at various frequencies. By default, pure tone test is selected when the device is turned on. Before administering the test, let's familiarize the common keys used in the test. Use the ear key to switch between right ear and left ear. Press the mode key to change the test mode from air conduction to bone conduction or to free field audiometry. Select the stimulus type from pure tone or warble tone using the stem key. The stimulus can be changed from continuous to pulsed from pulse key. Position supraaural or circumaural headphones on the patient and ensure that the ear cushions are correctly aligned and adequately cover the ears for precise sound delivery. The clinician should also ensure that the red audio cup is placed on the right ear and the blue audio cup on the left ear. Begin with air conduction test for the right ear at 1000 Hz and present the stimulus. If the patient responds, decrease intensity by 10 decibels and present again. Continue until there is no response. When there is no response from patient, increase intensity by 5 decibels and present the stimulus again. Once the patient responds, confirm it and mark the threshold by pressing Mark key. The marked intensity will blink once to confirm that the marked threshold has been registered. Repeat this process across different frequencies and intensity levels. If there is no response for a particular frequency at all intensity levels, press No Response to register it. Press the masking key to apply masking noise to the non-test ear. Masking intensity can be changed by pressing Intensity 2 key. Click Masking key to change the masking type from white noise to narrowband noise or to speech noise. Long press the masking key to turn masking off. After completing the right ear, perform the test on the left ear using the same procedure. Once air conduction for both ears is complete, proceed to bone conduction testing. Remove the air conduction headphones and place the bone conduction headphones on the patient. Ensure the bone conductor is properly positioned on the mastoid of the test ear. Start with one ear. Provide stimulus across desired frequencies and mark responses accordingly. Then repeat bone conduction test for the other ear. This concludes A, C, and BC testing. To communicate with the patient, press Talk Over to speak and Talk Back to listen to the patient. After completing testing for both ears, press Save. Confirm by selecting Yes, and the test will be stored. The next test number will be displayed on the audiometer display. If a Labat supplied thermal printer is attached to the audiometer, saving the test and pressing Yes key will result in printing of audiogram on thermal paper. To begin speech testing, press the Test key to activate the speech test mode. This test can be utilized for administering live voice test on the patient. Set the intensity level according to the patient's hearing threshold. Now press the stimulus key once. This activates the internal microphone and displays the VU meter. The audiologist will use a talkover mic to present speech and a talkback mic to hear the patient's responses. As the patient responds, record the response and note down the speech score for the selected intensity. Repeat this process to record speech scores across all required intensity levels. Once completed, press the stimulus key again to turn off the test. Next, press the Select key to switch to auxiliary speech testing. Connect any external audio sources like a mobile phone or CD player using an AUX cable. Set the intensity level based on the patient's hearing threshold. Press the stimulus key to begin. As the patient responds, note down the speech score. Repeat this process to note down speech scores for all desired intensity levels. Once completed, press the stimulus key again to turn off the test. To use recorded speech testing, press the Select key again. The Audiolab Plus includes 36 spondy words in English for testing. Set the intensity level based on the patient's threshold. Press the stimulus key to begin. The words will be presented automatically. Record each patient response using the yes or no key. Based on these responses, record the final speech score. Press the stimulus key to stop the test. Press the test key to initiate the tone decay test. A tone decay test is an audiological test used to determine a patient's ability to continuously hear a pure tone over time at threshold level. It helps assess auditory fatigue and can aid in detecting retrocochlear lesions, especially involving the auditory nerve. Instruct the patient to press and hold the response switch for as long as the tone is audible. Set the intensity level according to the patient's threshold and start the test by pressing the stimulus key. Monitor the patient's response using the built-in timer on the device. If the switch is held for less than 60 seconds, the stimulus will increase by 5 decibels. If the patient holds the switch continuously for 60 seconds, the response is considered sustained and the stimulus will turn off automatically. Change the frequency and adjust the intensity as required to evaluate all desired frequencies. Press the test key to select SISI test. The short increment sensitivity index test is an audiological procedure used to differentiate between cochlear and retrocochlear hearing loss by measuring a patient's ability to detect small 1 decibel intensity changes in a continuous tone presented 20 decibels above their threshold. Set the increment using the step key. An increment of 5, 3, and 2 decibels is used for practice of patient. An increment of 1 decibel is used to test the patient. Then, set the intensity and frequency according to the patient's hearing threshold. Press stimulus to start the test. The patient will hear a continuous tone with small increase in loudness. Ask the patient to press the response switch whenever they notice even a slight change in the sound. As the patient responds, the score will automatically be shown on the Channel 2 display. The clinician can make number of observations as per his or her diagnostic requirements. Press the stimulus key to stop the test. Use the mark key to mark the final SISI score. If further evaluation is needed, the clinician can perform the same procedure at 2000, 3000, and 4000 Hz for accurate assessment. Press Save and then press Yes to save the test results. Press the test key to select the ABLB test. The alternate binaural loudness balance is a possible test for recruitment that measures perceived loudness differences between the ears in a patient with unilateral hearing loss. Channel 1 displays the intensity for the right ear, while Channel 2 displays the intensity for the left ear. Select the frequency at 1000 Hz. Set the intensity of the good ear and the poor ear as per patient's hearing threshold. Press the stimulus key to present the tone. The tone will be presented alternatively between both ears. Change the intensity of the poor ear till the patient confirms equal loudness in both ears. Turn off the stimulus and click the mark key. Repeat the procedure at different frequency levels if required. To record the response, press Save and then Yes to store the test results. This concludes all the tests performed on the Audiolab plus Audiometer.